The MeniPass needle and cannula is introduced into the knee through the medial portal. The MeniPass needle is passed a few millimeters into the meniscus, which allows the needle to act as a joystick to assist in positioning the meniscus accurately against the margin. The MeniPass needle is then passed through the meniscus, the capsule and soft tissues to exit through the skin. A suture is then threaded through the eyelet of the MeniPass needle, which is then retracted back into the joint and safely back into the MeniPass cannula. The cannula is then repositioned to where the suture is intended to pass, usually into the capsule either above or below the meniscus, but sometimes through the meniscus again, depending on the configuration planned. Again, the soft tissues are grasped outside the knee and pulled posteriorly away from where the needle is expected to exit, and the needle is then advanced to exit through the skin. The suture is retrieved from the eyelet of the needle and pulled to even with the other suture tail, and then clamped together with artery forceps. Pass as many sutures as required to produce an anatomic reduction and repair of the meniscus. Once all required sutures have been passed, the leg is placed onto the footrest so that the knee is at 90 degrees. The posteromedial or posterolateral incision is then opened with the retractor and the sutures retrieved with an arthroscopy hook. Once all sutures are retrieved and exiting through the incision, the closest suture is held in one hand, while all other suture limbs are held tightly in the other. The single suture is pulled gently, and the corresponding suture thread in the other hand will become taut, which identifies the pairing of sutures to be tied. The first matched suture pair are tied securely against the capsule. The suture identification and knot tying sequence is repeated until all sutures have been tied.